From 120 under 40, the new generation of family planning leaders, it's Candid Conversations. Real people, real stories, real impact. A podcast where we talk to family planning and reproductive health champions from around the globe and take a deep dive into current topics in family planning and reproductive health, as well as the personal journeys of our champions, the challenges they faced, what excites them about the future, and some advice for other up-and-coming leaders. I'm Carolina Salmaron. Welcome back for our second episode of Candid Conversations. Today's guest on this episode is the Chief of Party of the Challenge Initiative Nigeria, and also my good friend Victor Igaro. The Challenge Initiative, also known as TCI, is about rapidly and sustainably scaling up proven reproductive health solutions among the urban poor, and this is done through a business unusual approach. What makes this approach unique is that it is demand-driven and the cities self-select to join TCI. They bring in their own financial and human resources. Thank you for joining us today, Victor, and giving us a chance to get to know you and learn about the exciting things you're doing in family planning. Why don't you tell us a little bit about yourself?
Thank you so much. I'm very delighted to be here. My name is Victor Igaro. I'm from Nigeria, and I'm very happy to say that I'm a 2019 winner of the 120 under 40 and one of the future family planning leaders.
Tell us a little bit about what you do.
I currently lead the Challenge Initiative. The Challenge Initiative is a global initiative that focuses on scaling up high-impact family planning interventions. And I have the privilege of leading the initiative in Nigeria. And the initiative is also implemented by the Johns Hopkins Center for Communication Program.
We are very familiar with the Challenge Initiative. We talk about family planning a lot. Tell us a little bit about what family planning is to you.
For me, family planning really is life planning. Why I call family planning life planning is really a means by which you give the people the opportunity to design the kind of life they desire. So it's really intentionally designing the kind of life that you desire. And we all know that the kind of life, especially if you come from the developing countries or if you come from Nigeria, where I come from, the size of family and the quality of life are very closely related. So family planning is one of the most effective tools by which you can ensure that the quality of life that any family desires is guaranteed, and that does not necessarily that's not specifically restricted to the size or number of children, but really the quality of life of the woman giving birth to the children, as well as the quality of life of the man looking after the family, and also the quality of life of other children that will have to compete for resources with their siblings. So it's life planning. It's not just about the individual, but it's about how you empower communities to determine and design the kind of future that they desire.
I love that. I love that family planning is a way of designing your life. That is amazing. So, Victor, you're a new 120 under 40 leader. What does being chosen for the 120 under 40 project mean to you?
So, I really want to use the opportunity to thank the Guest Institute for choosing me as a 2019 leader. And also all the sponsors that threw their weight behind this and have done this for the last couple of years. For me, the first thing I asked myself when I received communication that I've been chosen is, what is the responsibility that is desired? I say that because I am not someone that loves the limelight a lot. People call me, I'm the undercover boss. So I like to do things undercover and allow my work to speak and really just avoid visibility until I think it's a good time to come out. So when this award came, the question I asked myself is, how do I stay true and how can I use this award as a platform to execute my mission? And how can I, looking back, justify the investment that the sponsors as well as the Guest Institute have made in identifying me as a leader. So really, it's this award is more. It's not so much about me, but really about the people out there. It's about people that have not heard about family planning, people that do not have access to the opportunities, and also how I can shape the policy, I can shape the environment, and also how I can add my voice to amplify the issues around family planning. So really, that's what it means to me, and I'm very grateful that this platform is coming at this time, because I think there's really no better time for it to have come. Especially looking at how I have progressed in my path, in my leadership path within the space. And I feel very blessed that as an under 40 leader, I'm already doing the magnitude of work that I do, and I already have the opportunity to impact lives in the manner in which I am already doing that. So really, it's an opportunity for me to do more, and it's also an opportunity for me to recalibrate my strategy and explore the opportunities that the award brings to, blow up this space, and also get much more young leaders, to start paying attention to the issues of family planning.
Absolutely. And there are 80 other winners from previous years that are super excited to meet the new winners and start building their networks. And that is what the goal of the 120 Under 40 project is, to create a network for you family planning leaders to really get to know each other, to collaborate with each other, and to expand your reach beyond your countries, beyond your regions. And so we are very much looking forward to what's going to come out of Mr. Victor Igaro and his great dreams. So we're going to dive a little bit deeper into what drove you to family planning. How did you get involved in the family planning movement?
This is very interesting, and every time I'm asked this question, I respond with mixed feelings. So the first thing is, I did not intentionally find my path to family planning. I think family planning found me. When I was 6 years old, of course, a young boy that has zero knowledge about life. One day I walked into the room and I saw my mother, who had just given birth to my younger sister, just a few days old, and she was standing in a bath. So in Africa, there's this bath that you use to bathe new babies. So it's like a mini swimming pool. So she was standing in that bath, and all I could see was blood gushing out of her, like there's a tap turned on. I didn't know what it was, but I knew that seeing that amount of blood, it wasn't a good thing. So I quickly dashed out of the room and I started screaming, and I'm like, blood, 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 blood. And I was able to get some of my neighbors in, and they saw my mother. At that time, she was already losing strength because she had lost so much blood that the blood actually covered her feet. So her entire feet were immersed in blood in a big bath. So apparently that would have been huge volumes of blood. She was rushed to the hospital. Of course, I wasn't allowed to see her in the hospital because I didn't get to see her for many days. But thankfully, she recovered. And of course, growing up, that memory stuck in my mind, and I really never had the opportunity of asking what transpired until I became an adult and having conversations with my mother. And one day I asked her what really happened, and she said, I practically died and came back to life. And in the course of my career sojourn, initially I wanted to be an engineer, but when I continued to think about how my mother almost died, why she was bleeding, and what could have happened if we didn't have the opportunity at the time to access healthcare, I just couldn't get myself to believe that there are many women that go through that kind of situation. And that's how I got to know about postpartum hemorrhage and why it's one of the number one killers of women. You may not really connect that to family planning directly, right? Yeah, but one of the key complications for postpartum hemorrhage, even though my mother had a second child almost 5 years after she had me, is that many women that do not have the opportunity to space their children or do not have the opportunity to really have access to healthcare find themselves in such precarious situation, and if they do not have the kind of service that they desire, it's straight death, and people just die like that. So my first sojourn really into the family planning space is more of into the reproductive, maternal, newborn and child health space. So my earlier career was really around promoting access to reproductive, newborn and child health services. A lot of my initial work was around the RMNCH space. But as I progressed in my career, I really discovered that family planning was the most neglected piece within the entire puzzle. And so if you look at the RMNCH continuum, there's a lot of attention for reducing maternal mortality through direct interventions. For example, reducing postpartum hemorrhage. There's a lot of attention to reduce newborn deaths, by all of the interventions around cord care, breastfeeding. There's also a lot of attention, to ensure that the under 5 mortality is grossly reduced. But really, nobody pays attention to family planning. And I told myself, I think really this is the most neglected part within the RMNCH continuum, and I think this really needs a lot of attention. And so that's really how I gravitated towards family planning. And in the course of my research, postgraduate research, I started doing a lot of work around why people do the things that they do, studying behaviors and all of that. And I came to realize that there was a funny perception around family planning. And the reason why nobody's even paying attention to family planning is because people are not talking about family planning. So I think that sparked my interest a bit more, and I decided to go all in, and that's how I found myself here.
That's a great story. Yeah. Tell us about the biggest challenges in your country, in Nigeria, in terms of family planning and reproductive health.
So really, the challenges can be categorized into different buckets. So we have systemic challenges, and also we have environmental challenges. Of course, they are interrelated. And so what I mean by systemic challenges is that from a policy standpoint, we are not getting as much financial support as we should. I mean, it will interest you to know that from a $4 million commitment that was made last year in 2018, this year, 2019, it went to zero. So, and that came from so many years of making a case for family planning and making the government see reasons why they should commit its resources. So it's like just going back to start from the basics. So those kind of disruptive decisions and policy changes can actually be frustrating for the work that we do in the family planning. So that's one of the factors for the systemic. The second factor is that family planning is still treated as a standalone intervention. I think we need to find more integrated ways of implementing family planning as a part of the RMNCH package, and also mainstreaming family planning into almost all development sectors, not just health. So we need to mainstream family planning into how we do our work around economic empowerment, how we do our work around education, how we do our work within health, and even not just treating family planning from the standpoint of preventive care, but really get it into every fiber of our health system, and even get it into lifestyle medicine and all of those things. So that's on one hand. On the other hand is that we need to amplify discussions within the social space, amplify discussions to disrupt social norms, also to challenge cultural stereotypes, and also really to get people to understand that family planning really is not just about promoting promiscuity or challenging age-long religious inclinations, but really giving up people the opportunity to maximize the opportunities and live their lives to the fullest and be everything that they really need to be. So I think on both ends, we need both to really get us to, in quote, I like to call it the promised land, but we need to be intentional about how we engage all of the key players to make sure that both areas are well catered to.
I think with your strategies, Victor, and your vision, we're definitely going to get to the promised land soon.
Amen to that.
With that being said, those changes that you've seen since you became involved in the family planning realm, are there specific examples that you feel like, before I got involved, this wasn't a thing, but now I'm proud to say that it is?
Yeah, speaking about changes, the way I like to approach change is not just change within the community, but even change within the professional space. First of all, I think that the way with which health professionals tackle the issue of family planning has evolved. And I say that to say that a couple of years ago, there were people, professionals that I've interacted with that don't even want to have a conversation around family planning. Reasons being that family planning is one area that people hold personal sentiments, and those personal sentiments affect their professional work. Many professionals, health professionals, I have still not come to term that family planning should be accessible to everybody, regardless of age, regardless of gender, regardless of social status, regardless of religious inclination. So that is still one thing that for us as professionals we struggle with. But I'm happy to see that that has evolved, or that is evolving over time. People are more open to talking about family planning, at least having a conversation.
Mm-hmm.
People are also becoming more open to promote family planning. People are more open now to practice family planning. So it's a gradual process. At least you need to get people to talk about it. You need to get people to promote it. Then you need to get to practice it. So that's from a professional standpoint. Now, from a community standpoint, some huge changes I have seen over the last couple of years is, first, it is almost impossible for a parent to have a conversation with their adolescents or young children about not even family planning, about sex. It's not a conversation that can happen anywhere. In fact, the first they hear you mention sex, hell is going to be actually break loose, because you're seen as being corrupt, and also, corrupt in terms of morally, and you're seen as perhaps being influenced by bad friends and all of those things. So, but what we are seeing now is that parents are beginning to embrace the concept of allowing the conversation around sex to come in. That is where we are now. We really hope for that kind of conversation to expand beyond sex and now start talking about family planning. The second transition that we have seen over the last couple of years is that young people are becoming more bold and audacious in terms of even talking about it. And I really want to say that many of the young people that I know that talk about family planning, that have a voice for family planning, are some of the, in quotes, most morally straight people. People that I know personally.
That's very
that
surprising.
have a voice. Yeah, it's very surprising. You expect the bad ones to be the ones
more
talking about it.
ones.
Yes. But the funny thing is that I know people personally that are very vocal about family planning. And guess what? They may not even have been in a relationship, not have even experienced their sexual debut, but they're more bold now to have conversations with their peers and even have conversations in the public. And so really, I think that's one area of change that we are beginning to embrace as a society. Another area of change that we are beginning to see is that when discussions around family planning is happening, there is now a consideration for having young people to be a part of the conversation, to be in the room. I know that the ideal situation is to see young people lead the conversation, but it's work in progress. And like I always say, we need to be patient as we push and advocate for more youthful engagement. For now, we might not have the engagement as we desire. So let's embrace the participation as it is. Gradually, we will get our foot in the room. We will be in the room, and eventually will be in charge of the room. So it's a gradual process, it's a painful one, but progress is sure. Definitely we'll get to our destination. But I just want to say that I'm very happy to see that open conversations are happening. And even as a young person, I'm happy to see that I could talk about family planning without feeling any bias. I'm also active within the religious space, and it doesn't affect anything. I mean, I'm only making a point, I'm only sharing idea, and I'm also saving someone's life, because whether you like it or not, whether you talk about it or not, whoever wants to do what they want to do will do what they want to do. So
Isn't that the truth?
yeah, I mean, so you rather give them the right information or they get it somewhere else.
Yeah,
So I think really
absolutely.
that's a standpoint on which we base our campaign and our work with the young people.
Yeah, you're absolutely right. I mean, we've seen so many changes, and it's just amazing how far Nigeria as a country has come in the past 20 years, and all of Africa in general. I mean, the progress is tremendous, and we are so thrilled to have advocates like you that are making those strides to really push the needle in the right direction, in a direction that's, like you said, going to save lives, not just mothers, but also babies and adolescents, and help them design their futures, help them achieve their education goals, their financial goals, and like my good colleague Dr. Chris says, help the country in general achieve the demographic dividend. My next question, Victor, is about youth. And we've heard a lot about meaningful youth engagement in family planning. And as we saw during the International Conference of Family Planning in 2018, youth are coming in, and they're coming with a lot of enthusiasm, and they're really excited to be part of the movement. How can we ensure that we sustain the momentum and even go as far as amplifying the momentum and taking it to the next level?
I personally think that we need to review our narrative around young people, family planning, future, and all of that. And the reason is that there is no other way. There is really no other way to build the future that we desire than family planning. There is no other way to guarantee that the next generation will take all of the hard work of the founding fathers within this space, and also all of the investment of donors, of institutions like the Guest Institute, and all of the partners that work and collaborate with the Guest Institute to drive its vision, and also all of the individuals that have invested their time, their career, their energies, their resources to see this come to life. There's really no other way than to expand the space for the next generation of leaders to come in. So I think that sometimes all of the hue and cry about young people, all of the hue and cry about young people having a voice is non-negotiable. There's even no need to have a conversation around it, because there is no other way. There's really no other way. So I really, this is not a question, but really just to encourage all of us to say that I know it's pretty tough. I know that there are conversations around young people coming and they break all of the break things because they're energetic, they are crazy, and sometimes their energy might not be backed by evidence or data and all of that. But really, I think it's really just giving everyone an opportunity to bring their little piece of the puzzle and create a very fine canvas. I think that's really what all of this is about. And I really just want to encourage the Guest Institute and all of its partners to continue to do what it's doing, and continue to push its resources in this right direction. And very soon we will definitely win.
So I know we talk about family planning, and we use those words to mean so much more, at least for us in the community. But when youth hear family planning, a lot of them don't feel that pertains to them. How do you go about reaching out to youth and letting them know that family planning isn't just for people that are married, but is also for youth?
That's a very critical question, and before I respond to that, let me actually say that youth are not the only ones that struggle with understanding and relating with the issues of family planning. Even married people, even unmarried adults, all have that issue, and I'll tell you why. Um, People naturally, especially in the part of the world where I come from, people have some form of cultural reservation around family planning for two reasons. One, the initial discussion around family planning was linked to pregnancy prevention. And when you look at conversations with young people, the moment you talk about pregnancy prevention, people naturally connect it with promiscuity. Even amongst married people, when you talk about pregnancy prevention, people think about promiscuity, people think about wanting to avoid responsibility, people think about wanting to disrupt the cultural orientation. And speaking about cultural orientation in Africa, the more children you have tend to be seen as the more wealthy you are, and really that comes from an age long assumption that when you have lots of children, a man with lots of children means that he has more manpower to till the soil and to grow the farm and grow the crops. He has a bigger harvest. He's able to take the harvest to the market and get some money. That really is the age-long stereotype around how families are structured, and there's really a debate around who has the largest number of children in the community. And, people actually joke around it. And even growing up in my own generation, there were lots of conversations around whose family was bigger than the other. So really, there are many sociocultural determinants that actually influence how people perceive family planning. So I really just wanted to say that it's not an issue with just youth, but an issue even across different age groups. So that being said, for youth, we have come to see that the framing around family planning as it is really a struggle. One, because of the cultural sensitivities. Secondly, because of the perception of the purpose of family planning, which is connected to you're not married, why should you be having sex? And if you don't have sex, you don't get pregnant. And thirdly, around religious positioning, and also we come from in Nigeria. There's a lot of religious polarization. So it's either you belong to one group or you belong to the other group. And whichever way the pendulum swings, there tends to be a strong aversion for premarital sex outside of a formal legal relationships. So all of these issues put a lot of pressure on the community, especially with young people, to openly discuss issue of family planning. So one way by which we have tried to demystify conversations around family planning and expand the opportunity for young people is changing the framing and throwing the family out, leaving the planning and maybe call it life planning, or maybe call it empowerment. Or we look for some fancy names that can resonate with the young people, their parents, and even the community, to pull the young people in so that they can actually have a voice within this space.
What do you think our future looks like in terms of family planning? What is your vision for the future, and what steps will you personally be taking towards achieving that vision?
All right. So my vision for family planning is, just simply put, I would like family planning to be democratized, which means that everyone should have access to information. Everyone should have access to service without bias, without question, without any form of limitation whatsoever. That's really the future that I see. But I do not desire that future in isolation. I believe that the more we strengthen our systems, health systems, the more we push for more progressive policies and policy environment, and the more we strive for more inclusive and more inclusive funding for family planning and other health services, the more we get close to achieving that goal. So that's really the future that I desire. And I think that it's not impossible. I really do think that it's a misconception that we cannot attain we cannot see the kind of health care system that we desire. I don't believe that. I just believe that government needs to know how to prioritize, and government needs to play more coordinating role in harnessing the resources at its disposal. That's just my personal position. Another perspective to that is that I really think that a lot of people treat family planning with kids' glove. Family planning is seen as other people's problem when it's being treated, but becomes everybody's problem when the consequences blow out. And I think that if everybody thinks that access to family planning is the gateway to solving most of our social and economic problems, then we'll take it more seriously. And I'll give you an example. When you look at the figures, school dropout figures, it's very easy to connect the dropout rate with issues around family size, issues around economic empowerment for families, issues around even learning outcomes that has a close relationship with nutrition, with healthcare, with all of these other factors. So there's a correlation between all of these things. It's family planning is supposed to be like a fulcrum for our economic and social development. And so if we see family planning not as the end, but as a means to the end. So, for example, if you want people to stay in school, then family planning is a tool to making that happen. Mm-hmm. Or if you want people to stay off drugs and be able to pursue personal and professional interests, then family planning is a means. Or if you want families to have stronger earning power, you want them to be able to have jobs and pursue whatever interest. If you want the woman to be able to return back to work and perhaps earn a living and support her family, family planning is a tool. So really, family planning is not the end in itself, but rather it's a means to an end, and it's a means to achieving all of these social and economic objectives.
So you've told us a little bit about your general vision. So let's take a look at your goals. What are your goals, Victor, for yourself?
So goals for myself might not be directly connected to family planning, but has some may not be directly related to family planning, but might be connected in some way. I say that because I have very ambitious vision for myself, and I'm very Afrocentric, which means that I believe in the African dream, and I believe that people can be the best that they can be in Africa, and we can actually transform Africa from being being at the receiving end to really be taking a center point in global discourse and actually being instrumental to bring in transformation for themselves. So my goal really is, I could summarize it to be expand opportunities for Africa to be more involved in decisions that concern them. And this includes increasing participation in terms of policies. This also includes being empowered to create solutions and drive those solutions to become sustainable. And this also includes ensuring that there's a steady and continuous pipeline of resources to drive those solutions and making them sustainable. And so all of this can be summarized in three things that I really want to achieve on the long term. One is that I want to be a key leader in driving social innovation in Africa. Secondly, I also want to be a key leader in helping to shaping conversations and discussions around how Africa can be positioned to be at the center point for policy and action. And thirdly, I want to be at a position where I can advise on how we can channel resources and funding to drive social development in Africa. So I have very ambitious dream to be one of the biggest venture capitalists that is focused on impact investing in Africa. That's a tall order, because when you hear about impact investing, you expect it to be billionaires that play in that space. But why not? I actually have the dream to be a big-time impact investor at some point, especially focusing on accelerating development in Africa.
That is amazing, and that is incredibly ambitious, and I think you're getting there.
Yeah.
You're well on your way.
Thank you. I think that as some pat on the back.
Yeah, I mean, it's amazing that you have these great goals and that you want to give back, and I think that is one of the reasons why you were chosen as a 120 under 40, and you continue to give back, and you continue to try to teach others and build the capacity, and I think that's what makes you a true leader. So as a family planning advocate and leader, you've been working in this space for many years. What is your piece of advice to a young leader that's just starting in family planning? Something that you wish you knew when you had just started?
So I think one advice I'll give to a young leader within this space is be focused, define what you want to work on. It's very easy to be sucked in and be knocked about by all of these things going on. Some people think that it's when you are an activist or an advocate that you have a space. Some people think it's when you are fighting with government that you have a space. But guess what? I think there's space for everyone. And for me, I started my career as an advocate. But as I progressed in my career, I became a development strategist. I started working on policy at some points. I started working on programs. I started working on the fields. I started working in the community. So having experienced all of the different components within the development ecosystem, I've come to see that everybody, whether it's an advocate, as an implementer, or as a designer, we are working towards one common purpose: to ensure that people are able to maximize their lives and explore the opportunities that they have to the fullest. That is the bottom line. So I would really just advise young people to find your onions, find your space, know your strength, and pursue it to the fullest, and don't be distracted. And also don't allow you just need to stay focused and build a path rather than jump everywhere. Because for me, jumping everywhere is like sowing a seed, and while the seed is germinating, you are transplanting it, and before it understands the environment, you are transplanting it. So really, I want to summarize my advice to young people as quoted from Carol Larson from the Packard Foundation during the 20th anniversary celebration. And she said, stay long and go deep. So for all young people out there, stay long and go deep.
Victor, it has been incredible chatting with you. Thank you for providing us a glimpse into your past and sharing such a powerful story from your childhood. It has been fun talking about having that designer life and big dreams. We're excited to see what your future brings. Hopefully next time we chat, I'll be chatting to one of the biggest venture capitalists in Africa.
Thank you so much for having me. I'm very delighted to be here with you, and I'm also very happy to do this again. Thank you.
You've been listening to Candid Conversations. If you like what you hear, please visit our website, www.120under40.org. This podcast is made possible with support from the Bill and Melinda Gates Institute for Population and Reproductive Health at the Johns Hopkins Bloomberg School of Public Health and Bayer. This episode was produced by me, Carolina Samaron, Kelly Wellborn, Owen Ramon, and Owen McCusker at Multimedia Production at the Johns Hopkins Bloomberg School of Public Health. Music for this episode was provided by pond5.com. Please stay tuned for our next episode. Once a teacher, always a teacher.